Hi, my name is Brooke and I'm making a video today to demonstrate proper PPE precautions. So today my patient has herpes zoster single dermatome, so I would perform hand hygiene on the way into my patient's room, and it is a standard precaution, so all I would need to do is wear gloves. So I have my gloves here, and I would put them on. I would help my patient with whatever I was in the room for, and upon exit, I would remove my gloves and dispose of them. Perform hand hygiene again.
Good.
Okay, so I'm going to move on to my next patient. This patient has herpes disseminated, which is contact precautions, so I'm going to be using a gown and gloves. So upon entry into the room, I'm going to sanitize my hands. I'm going to put my gown on, which I would actually do outside of the room. I'll put my gloves on. So this is the standard contact precaution. I will assist my patient, and when I am leaving the room, I will remove my gloves. I will dispose of them, and then I will remove my gown. Pull it up, throw it away. I'll do hand hygiene again, and that's it. Okay, so now I'm going to be moving on to my next patient, which is an immunocompromised patient, and that is droplet and contact precaution. So I'm going to enter the patient's room and perform hand hygiene. I'm going to put on my gown. I'm going to put on my shield. And I'm going to put on my gloves. So these would be the proper PPE for an immunocompromised patient. So I'm going to assist my patient, and upon when I'm getting ready to leave the room, I'm going to remove my gloves, properly dispose of them. I'm going to remove my gown, dispose of it, and then I'm going to remove my shield. Oh, and then I'm gonna wash my hands again. Okay. So now I'm going to be moving on to my next patient who has C. diff. C. diff is a contact precaution, so I'm going to enter my patient's, well, I'm going to perform hand hygiene, put on my gown, tying this thing is a real art of nursing. Okay, now I'm going to put on my gloves, and now I can enter my patient's room. I'm going to assist my patient, and upon exiting the room, I'm going to remove my gloves, dispose of them, and remove my gown. Then I will perform hand hygiene again, and I will exit my patient's room. Okay, now I'll be moving on to my next patient who has meningitis, and the precautions for meningitis are droplet precautions. So upon entry, I will perform hand hygiene. Droplet is a face shield and gloves. So first I will put on my shield. Then I will put on my gloves. And these are the standard precautions for a patient with meningitis. Upon leaving the room, I will remove my gloves, dispose of them. I will remove my face shield, dispose of it. I will perform hand hygiene again, and that's it. Okay, so now I'll be moving on to my last patient of the day who has TB. So they will be in a negative pressure room. So I'm going to want to put on my mask, my N95 mask, before I enter the room. What's happening here? Okay. That's right. So now I'm safe to enter my patient's room. I'll perform hand hygiene. I'll put on gloves. And these are proper precautions for a patient who has TB. Upon leaving, or before leaving the room, I will remove my gloves. I will perform hand hygiene. I will exit the room before I remove my mask. So once I am outside, I can safely remove my N95 mask. And that is it.